Welcome back to Urgent Care. This is Minda Wilson. Today I'm excited to talk to Shandon Fowler, a fellow healthcare traveler who's interested in all things political related to the Affordable Care Act and its impacts, and guy interested in solving the problems that have resulted as a result of its passage. Welcome to the show, Shandon.
Thank you for having me, Minda. Very happy to be here.
So, since the Affordable Care Act has been passed and the Trump administration has issued some executive actions, what do you see the landscape being now for healthcare?
I think it's an interesting combination. I was just thinking about this yesterday, where it's an interesting combination of incredible change and status quo. You have, on one hand, and I think that last year was pretty indicative of that, especially on the political front. You had a lot of activity, a lot happening on Capitol Hill, a lot happening in Washington, D.C., conversation about repeal and replace. But at the end of the year, repeal and replace itself did not happen. Nothing really changed, and it was actually tax reform that saw the only major change, that brought one of the only major changes to the Affordable Care Act, which is basically zeroing out the individual mandate. You did also, as you mentioned, there are executive actions that Trump has taken, and those will take a little bit longer to play out. But I think that you could see some real change there. So, but at the same time, that you see these changes, and some of them which could be significant, you also see that the problems are the same that they've been for years and years and years, actually decades, and that is that costs are rising faster than inflation, and employers are really, getting to the point where they're ready to take really aggressive action to, take costs under control in a way that they don't think that they've seen other players in the market, such as the health insurance carriers and pharmaceutical companies and provider networks and so forth, do it. And I think that's what was behind Amazon and the Amazon Berkshire Hathaway, JP Morgan Chase announcement was companies in general saying, listen, we're not going to sit on the sidelines anymore and just get our annual bill from our carrier or our administration services organization. We've got to do something about this.
So a couple of questions that I get asked frequently about where we stand now with corporations. Repealing the individual mandate, that doesn't mean the burden on corporations to provide the benefits under the Affordable Care Act is repealed, does it?
No, not at all. As a matter of fact, there is something called the employer mandate, which many employers are very familiar with, mainly because there are significant reporting requirements that come along with the employer mandate. They're 1094 and 1095C forms for self-insured employers, which most large employers in the country are. And there's significant burden because employers are essentially having to prove that their workers, any worker that it works more than 30 hours per week and therefore qualifies for employer-based coverage, is being offered that coverage whether or not they accept it. So I would say, I don't think anybody has tabulated this, but from my experience, I would say that this has added billions of dollars in administrative costs to employers, and they're still sort of on the hook for providing their employers with benefits.
And the type of policies where they used to be able to provide these quote unquote skinny policies, which were basically true catastrophic coverage. And now they're still required to provide more expensive policies with higher deductibles that may not necessarily give better benefits.
Well, yes and no. Catastrophic coverage is not. I'm not a huge fan of catastrophic coverage because I think that it is truly catastrophic. So if you're young and you are healthy, catastrophic coverage can be something that is, essentially covering you from catastrophe, which is sort of the name that's given. But the coverage itself has updated a little bit, and there was sort of a minimal spike there. But really, it's not less than, and in fact, over the past, 5 years, the trend has been lower increases in total employer-based costs than the previous 10 years, year over year. So that's not to say that costs aren't going up. They're just going up at a little bit of a lower rate than they were before. So now, is that sustainable? Who knows? But, as I said, it's, chaos, but there's also a status quo element there too.
Now, do you think that's because more of the costs are being passed on to the employees?
Certainly more costs are being passed on to the employees. So if you look at the organization that I previously worked for, Benefitfocus, we did an annual survey or an annual study called the State of Employee Benefits. And what we found, which is in line with other major surveys like the Kaiser annual survey, showed that employers, as the costs have continued to rise year over year, employers have shifted more of the costs to employees. So whereas employers would, in the past pay 75% or more of their employee benefit costs, now it's closer to 60, even 50% in some cases. And so while costs are rising, they're actually rising, and they feel even harder on employees because employers are taking up less of that slack because they have less money in their budgets, or they don't have more money in their budgets to pick up that slack.
So even though the rise may not be as steep for employers, the cost for employees overall is rising in a time when wages are not rising significantly.
Yeah, absolutely. And again, this has essentially been the story. So, irrespective of the Affordable Care Act, I think that this has been the story for decades. So you can there's a chart that shows the cost rise, or the rise in costs of employer-based insurance from the 60s on. And there are very few years where those costs haven't risen faster than cost of living, inflation, and wage growth, especially in the past 20 years, wage growth. Some say that the reason wage growth has not grown is because of the continued rise in healthcare costs. So it's definitely putting a pinch on, multiple areas of employer, budgets and overall, and also, employee finances and budgets, and just, staying afloat, week to week.
So my understanding is, going back to the new, the JP Morgan, Chase, Berkshire, Amazon alliance, my understanding is they're putting together something akin to a multiple employer welfare association, a MIWA, which will allow them to change the structure of the benefits they're offering. Do you feel that's the trend?
Yes, absolutely. And when I heard about the announcement, I sort of read about it on my way out the door that day. And then a couple of hours later, I checked in again, and it was getting all of this press. And I was actually really surprised, because it was something that, having worked with large employers for, a number of years, virtually every large employer who is self-insured is looking at their options in this regard, looking at a way to essentially take the reins a little bit more, because they feel that their administrators or the health insurance carriers aren't doing enough to keep their costs down. So I've heard of MIWA arrangements. I've heard of, obviously, getting back to the Trump executive order, there's the sort of association health plans for smaller companies. Employers are just essentially looking for any way they can to cut costs, and they feel, whether it's justified or not, I think this is another issue entirely. They feel that, they've been the health insurance carriers and the providers have not been active enough in reducing their costs, and the pharmaceutical companies. So they want to use their data in a much more smarter way to bring down their own population health costs.
So how do you think this will all play out for employees? Do you think benefit costs will go up? Do you think if we follow the JP Morgan, Chase, Amazon, Berkshire trend, how do you think this will play out for employees in the future? Do you think they'll be faced with more healthcare costs, less healthcare costs, different types of healthcare costs? How do you think that's going to work?
Well, it's, if this was, 5 or 6 years ago, I'd probably have a more definitive and wrong answer for you. But, the longer that I'm, sort of in this space and, the more I get an understanding of what happens with healthcare and especially employer-based care, I think that what's going to really happen is that you're going to see uneven results, just as you've seen uneven results now. So there are companies out there who I've spoken to, a lot of them, who have either zeroed out their annual trend or they've reversed their annual trends. And then there are others who have not. And the difference is, there are many differences. Do they have an active broker or an active consultant that's helping them with this, or an active administrator? Are they able to really get access to their data and use their data or gain insight from their data that's really helping them with population health management? And I think that, one thing that I've found is that even people who are in this business don't really understand self-insurance, the idea of self-insurance for employers. So what it essentially means is that employers are their own insurance companies, really, and they're covering all of their employees' costs. I think most employees have no idea. They just assume that Aetna or Blue Cross or Blue Shield or whatever the name is on their card is covering those costs, but it's really their employer. So what you might see is, with a really smart, trio like Amazon and Berkshire Hathaway and JP Morgan Chase, they're going to do tremendous things for their employees in the short run. And maybe at some point, a decade from now, that'll start trickling down to other companies. But it's going to be uneven. It's going to be, chaotic. Hopefully, ultimately it'll be a really wonderful thing. But nothing's changing anytime soon, I don't think.
So you don't see a movement towards national, like a single payer plan, or as costs go up, you don't see that happening in the long run?
Well, that's the X factor, I think, because, and I mentioned this in a number of conversations with people after that the press release and that day of huge press and the health insurer stocks going way down. Basically, the reason why those companies and other companies that I've spoken to who haven't made a big press announcement about wanting to take this kind of action, they're basically almost at the last resort phase. Their costs are so high, they're eating up much more of their budgets. And since we are in a very competitive labor market right now, they're seeing those costs even more because they have to have the best benefits to fight for the best talent, to compete for the best talent in the market. So they're seeing their budgets really be, pinched by, pinched is a mild word, but by all of this. So they are, and if this doesn't work for whatever reason, if they're unable to get costs down and get them under control, then I think they have to start looking at other options like dropping coverage. And I think that for that reason, the Trump executive order on health reimbursement accounts being able to be used for individual coverage, not employer-sponsored coverage, group sponsored coverage, is really interesting, because an employer could at some point say, something, we've tried. I just want to give you money and let you go out on the individual market. I wanted this to be like your 401k, where I give you a match and and we'll help you find something. Maybe there will be some sort of Vanguard type company that comes along with on the insurance side. And I'm just going to give you money. I'm still going to get my tax deduction for that money. And you go ahead and go find your own insurance.
But we've learned in the individual market that the insurance companies are not always the best provider of care for individuals through individual policies. We know that we've looked at individual versus group policies, and we know that group policies get better coverage. So we also know that group policies pay less. So I think that all that's doing is transferring more money into the pockets of the insurance companies. What the advantage of the Multiple Employer Welfare Association is that it significantly reduces administrative costs. And don't you feel that that's a place where some legislation might be helpful, maybe regulating in a better way the amount of costs that these insurance companies spend, quote unquote, on administrative costs?
Well, they kind of have already with the MLRs, if you recall, the medical loss ratios. There was they did that, and it did it did, I think, have an impact. But of course, the insurance carriers would tell you that it added, quote unquote, unnecessary administration to them to track that that value to them. But I think you're absolutely right that because administration is something that's really, if you look at the many things that are driving costs in the healthcare space, administration is certainly one of them. It's by most accounts, it's double what it might be in other industries just to get through administration. So I do think that there is much room for legislative improvement to MIWA arrangements, to HRA, the way that HRAs are managed. I mean, to the way that health savings accounts are managed. I mean, why not just open up health savings accounts to everyone who's covered? So absolutely, there are many, many options. But, at this point, and I don't mean to sound like, totally jaded, but, after a year of, much debate and nothing happened, it's, I think that nobody's kind of, sitting around waiting for Washington, D.C. to do the rational thing.
But also a lot of insurance regulation is at the state level. So do you feel that there's an opportunity to maybe work more locally to change things?
Oh yeah, absolutely. I would say that a lot of it needs to be local. Now, it is interesting because it's such a, as you know, there is such a complex regulatory landscape to navigate. There are the sort of national rules or the federal level rules, and you have to make sure that you're in step with those. There does seem to be some openness to new methods. We've seen, and this is neither an endorsement or a sort of naysaying, but you've seen like the Medicaid work rules that have come out. You've seen this thing in Idaho that's come up where they're actually, it feels like they're actually breaking the law, at the federal level, but they're trying to get something done at the state level. And this is kind of the pattern for a lot of things, right? You see that
marijuana,
marijuana, car safety. I remember reading years ago that basically the California Transportation Safety Board was more powerful than the National Transportation Safety Board. So yeah, if you see things happening at a local level, or if things happen at a local level and something works really well, then absolutely you should try to replicate it. And in fact, that's what the Affordable Care Act was, right? It was Romney Care before it was Obamacare, as they say.
Yeah. But so if you were going to pick 3 areas of focus to advise people in structuring their policies with their companies, for structuring their policies with their insurance companies, what would be the 3 key recommendations you would make to them?
I would really focus on population health management, and that essentially would mean taking a look at your data and creating plans that are going to help you cut down on or find ways to make early intervention work, to find ways to make your unhealthy populations more healthy, and you keep your healthy populations healthy, because we know, from years and years of data that 5% of your workforce drives 50% of your healthcare costs. So if you can get that down even a couple percentage points using the data that's available to you, then I would do that.
Okay.
I would also
now wait. So how would you do that? Physical fitness programs in the office, gym, for a 50 to 100 employer-sized company, how does that happen? Because they hear that all the time, but they don't hear examples of what they could do.
Yeah, no, and I'm glad you asked that question, because I absolutely don't mean, put in a wellness program, because wellness programs have been challenging for the same reason that wellness is challenging, whether you're looking at it through the workplace or individually. You got to get on board with it. What I'm talking about is, more early intervention. So there are numerous companies that I've spoken to who have sort of gone the route of just having what would be a relatively rich PPO plan. And then on the back end, they're using healthcare concierge services. There's a company called Accolade. There are others who do this, who essentially have, real life operators who, talk to you and say, okay, you had a test, you're pre-diabetes. We need to really get you on this medication. We need to make sure that you're doing it. So it's really more of a, helping your unhealthy populations stay healthy, and also, guiding your healthy populations to make the right decisions about going to a doctor as opposed to going to the emergency room, or using telemedicine, these kinds of things. So it's much less the old sort of, let's, get everybody together and do a boot camp at work, and more about being able to personalize some of your plans and manage people's health, as opposed to, the old sort of exercise route and so forth. Does that make sense?
Yeah, it does. I just, a lot of people aren't familiar with the trends, and it's helpful for them to know what's happening. And then the second point you were going to make?
The second point is that I would really, and this one is super hard. This is the one that I think where there's the most excitement about Amazon being involved, is transparency, price transparency. I think that, there have been many people have said, rightly so, that this is the only industry, or this is one of the few industries where you can't really track down a cost until after you've done something in many cases. And the costs are so out of line with what, is sort of typical supply and demand, that that you as a consumer, we're being asked to manage more and more of our healthcare spend. We have higher deductibles, and we don't have the tools available to us to do that. So as an employer, especially as a self-insured employer, you own your data, and you should be forcing your your networks, whoever you use as a health carrier and provider, to make their costs known to your employees, because that will help them to make smarter decisions in terms of the relative costs that they might be spending on things. So I think that when you have cases that it's easier to get a straight answer from a mechanic than it is from a doctor, things are a little bit out of whack. So I would really encourage healthcare transparency, and would really encourage employers to use their leverage, self-insured employers in particular, and association health plans, if they are able to come back around, to really use their leverage to drive that kind of change in particular.
Mm-hmm. I agree, but the thing is that we haven't, when your life is on the line, people aren't necessarily in that moment worried about the cost. They'll take what they need, and then they'll worry about paying for it later. So how do you sort of, in that moment when they say you have cancer, you need surgery, people aren't really always prepared to shop. So are there are there tools that people can use to sort of help them manage that? Is there anything available that people can use? What would you recommend?
Well, again, this is where employers can be very, very influential and be very, be good stewards of their employees' health. So the reason why I mentioned population health first is because population health management first is exactly what you're describing. That when you're in an emergency situation, when you're sick, you're not shopping around. It's not like you got an offender bender and you're seeing who is giving you the best price to fix your car. You need something immediately. So if you can, and a lot of those sort of you need something immediately circumstances are things that early intervention can help you to avoid. But some of them are unavoidable. Getting a cancer diagnosis is something that's unavoidable. Being well along with heart disease is something that you can argue whether it's avoidable or not. But once you get to that stage, you need something immediately. So, whereas, on one hand, you're doing population health management for early intervention, you're doing price transparency to help your employees make better decisions. The third one that I've seen that I find really interesting is the idea of supporting centers of excellence. You've seen Walmart do this. You've seen other companies do this, where Walmart will essentially, if you have heart disease, if you need to have heart surgery, they will pay for your services 100% if you go to the Cleveland Clinic, because they know from research that somebody who goes to the Cleveland Clinic rather than going down the street to the closest doctor or the closest hospital is far more likely to avoid complications, malpractice, whatever it might be, and those are costs. In addition to just reducing your life satisfaction, and the how long you may live, there are costs there. So we'll spend more up front. The idea of the centers of excellence is we'll spend more up front to send you to the Mayo Clinic or the Cleveland Clinic or wherever it might be, in order for you to be healthier, short and long term, and in order for us to save more money over the long run.
I also think and hope that there'll be a return to more overall diagnostic practices. One of the problems we have now is that diagnoses are made in series. So you come in, because of the way insurance companies work for reimbursements, you have to say they have this, so we'll test for this. They don't do a broad series of tests to say, well, what is the matter with them? And so that prolongs the treatment. Whereas if you allow diagnostic reimbursement, you can shorten the time frame by identifying up in a relatively shorter time frame what's the matter with the person.
Yeah, I agree 100%. And I think that, there's been a lot of discussion over, for quite a while, but more recently over the difference between fee for service and, the medical home, so to speak, where you have more value-based insurance design on the front end, and then you have the more holistic approach all the way through, so that you're not doing it based on a sort of check or a sort of insurance-based checklist of what you need to accomplish, but more of a health-based checklist of what you need to accomplish.
So if someone's interested in learning more about you and what you do and how you help employers, how do they what's the best way for them to contact you?
My email address is the best way. It's Shandon, SHANDON, at Four 8 Insights.com. You can follow me on Twitter. I'm Shandon Fowler, and you can also find me on LinkedIn, also under Shandon Fowler.
Shandon, it's been really great talking with you. I look forward to many more conversations about what's going on in healthcare, and I appreciate you coming.
Thank you so much, Minda. It's been wonderful being on.
This is Minda Wilson for Urgent Care. We'll catch you next time.